Hey there, future nurse. Now, I know I'm jumping ahead a bit here, but I'm sure you'll enjoy this video. And if you do, make sure to visit my YouTube channel, Baby Nursing, for much more content to come in the future. The best part? You can subscribe for free. Welcome to Pharmacology in Practice, where we present real-life patient case studies to help you grasp and remember key pharmacological concepts better. In this video, we'll delve into various drugs and explore detailed patient scenarios to see how they're actually used in clinical practice. Let's begin with statin medications, which are frequently prescribed for managing high cholesterol levels and lowering the risk of cardiovascular disease. Statins function by inhibiting an enzyme called HMG-CoA reductase, crucial for cholesterol production in the liver. By reducing cholesterol levels, particularly low-density lipoprotein LDL, which I like to call the loser lipids or the bad cholesterol, statins help prevent plaque buildup inside the arteries, thus lowering the risk of heart attacks and strokes. One of the most commonly used statins is rosuvastatin, also known by its brand name, Crestor. But to better understand the real-life application of rosuvastatin, let's look at a practical example. Meet Jerry, a 58-year-old patient with a family history of heart disease. During his annual physical exam, Jerry's blood work showed elevated LDL cholesterol levels despite following a healthy diet and exercise routine. His doctor recommended rosuvastatin to help control his high cholesterol levels and reduce his risk of cardiovascular events. Jerry was prescribed a daily dose of 10 mg PO of rosuvastatin and was advised to continue his lifestyle modifications, which can be quite challenging. At his follow-up visit 3 months later, Jerry's LDL levels had significantly improved, and he reported no major side effects from the medication, which is great. This scenario illustrates the use of rosuvastatin in managing high cholesterol, especially when lifestyle changes alone are insufficient, and the patient has a higher risk of cardiovascular complications. But what if Jerry's 10 mg dose didn't sufficiently lower his LDL levels? For instance, if Jerry's labs showed improvement, but his LDL levels were still above the target range for his risk factors, his doctor might consider prescribing a higher dose of rosuvastatin to achieve optimal cholesterol control. After discussing the potential benefits and side effects, Jerry's doctor decides to increase the rosuvastatin dose to 20 mg per day and advises him to monitor for any muscle aches or liver enzyme elevation, a significant side effect of higher statin doses. During this visit, Jerry is also reminded to maintain a healthy diet, like avoiding fast food, exercising regularly, and taking other medications prescribed alongside the increased rosuvastatin dose. Together, these measures aim to further reduce Jerry's risk factors for heart disease and stroke by getting his cholesterol levels within the desired range. This scenario highlights how sometimes an increased statin dose is necessary, especially for patients who do not achieve their cholesterol goals on the initial dose. Now, let's expand our discussion on statins to include potential side effects and monitoring. While statins are generally well tolerated, some patients may experience side effects such as muscle pain, known as myalgia, or more severe muscle damage called rhabdomyolysis. It's essential to educate patients on recognizing symptoms like unexplained muscle pain, tenderness, or weakness, and to report these symptoms promptly. Additionally, regular liver function tests are recommended to monitor for hepatotoxicity, especially with higher doses. Ensuring patient adherence and addressing concerns promptly can help mitigate these risks and optimize therapeutic outcomes. Next, let's discuss adenosine, a medication used to treat certain types of abnormal heart rhythms, particularly supraventricular tachycardia, SVT. Simply think of SVT as a super fast heart rate. Adenosine works by slowing down the conduction through the AV node, or the atrioventricular node, which is the electrical connection between the atria, upper chambers, and the ventricles, lower chambers of the heart. This helps restore a normal heart rhythm in patients with SVT. So with adenosine, think of it as putting the heart rate down. Now, let's dive into another patient scenario. Meet Sam, a 42-year-old patient who arrived at the emergency department with palpitations, chest discomfort, and shortness of breath. Her ECG, or electrocardiogram, revealed that Sam was experiencing an episode of SVT with a heart rate over 180 beats per minute. Wow, that's high. After establishing IV access and continued cardiac monitoring, the emergency provider administered a rapid intravenous push of 6 mg of adenosine. Within seconds, Sam's heart rhythm converted to a normal sinus rhythm, and her symptoms resolved. Phew. That was close. This scenario showcases the use of adenosine as a rapid-acting medication to restore a normal heart rhythm in patients presenting with specific types of tachyarrhythmias, such as SVT. Now, let's explore the administration of adenosine in more detail. Adenosine has a very short half-life, usually less than 10 seconds, which requires rapid administration and immediate flushing with saline. Patients often feel a brief period of chest discomfort, flushing, or a sense of doom immediately after administration, but these effects typically resolve quickly. It's important to inform patients about these transient side effects beforehand to alleviate anxiety during the procedure. Close monitoring is essential, as adenosine can cause brief periods of heart block or asystole before the heart rhythm normalizes. Moving on, let's discuss another essential medication class, beta blockers. Beta blockers are commonly used to manage hypertension, angina, and certain arrhythmias, as well as to prevent migraines. They work by blocking the effects of adrenaline on beta receptors, which helps slow the heart rate, reduce blood pressure, and decrease myocardial oxygen demand. Let's consider a case study to illustrate the use of beta blockers. Meet Lisa, a 50-year-old patient with a history of hypertension and angina. Despite being on a calcium channel blocker, her blood pressure and angina symptoms were not adequately controlled. Her doctor decided to add metoprolol, a selective beta blocker, to her treatment regimen. Lisa was started on 50 mg PO of metoprolol twice daily, and her doctor explained the importance of taking the medication consistently and monitoring her blood pressure regularly. At her follow-up visit, Lisa reported significant improvement in her angina symptoms and a reduction in her blood pressure readings. However, she also mentioned feeling more fatigued than usual, a common side effect of beta blockers. After a thorough discussion, her doctor adjusted her dosage to 25 mg twice daily and advised her to monitor her symptoms. This scenario highlights the importance of individualized treatment and ongoing patient education when managing chronic conditions with beta blockers. By connecting pharmacological concepts with relatable patient case studies, we hope you better understand and remember the indications, mechanisms of action, and clinical applications of these medications. Stay tuned for more pharmacology and practice videos, where we'll continue to bring pharmacology to life through engaging patient scenarios. Remember, nursing students, understanding pharmacology is essential for providing safe and effective care for your future patients. Keep learning and exploring these real-world applications to become a confident and knowledgeable healthcare professional. Thanks for watching today's video. Don't forget to type Simple Nursing. YouTube into your search bar and join well over 1 million students hacking their nursing school system.